Over the last 25 years, I've been one of the leading experts retained to evaluate patients who have potential respiratory health effects with respect to mold exposure. Our basic approach to assessing somebody who has had an alleged mold exposure is to do a thorough allergy and asthma evaluation. This would include not only skin prick testing to molds that potentially the person was exposed to, but also to allergens that the person might be exposed to in everyday life that could actually be causing the problem and not actually the molds that they might think could be causing the problem. There are three mechanisms by which mold can cause respiratory disease. The first is an irritant mechanism, and the best way of thinking about an irritant mechanism is, for example, looking at the people who were living around the September 11th tragedy with the World Towers. The dust exposure caused a lot of respiratory problems, and it was simply the irritant effect of the dust that caused ongoing respiratory problems. The second mechanism by which mold can cause respiratory problems in the lower respiratory tract is by developing an asthmatic mechanism. This would be determined by doing objective pulmonary function testing to see whether one has developed asthma. The third mechanism by which mold can cause disease is a mechanism called hypersensitivity pneumonitis, where one develops precipitating antibodies to mold antigens. This is relatively uncommon and is rarely seen. If there is in fact a mold exposure, it is very important to eliminate the moisture. By eliminating the moisture and the water source, it will prevent mold growth and further exposure. If someone is actually having ongoing symptoms in an apartment or a house that may have some mold, it would be important to remove the person from the environment or actually physically remove the mold that's in the apartment in question. Any allergy develops by first having an exposure. Then the second step is the body will develop an allergic antibody, an Ig antibody, to the mold. And the third step is one has to develop clinical symptoms to the exposure. So all three of these are necessary for one to actually have a mold allergy associated allergic rhinitis condition or a mold allergy asthma condition. Those who have pre-existing allergies are at more risk of developing mold allergies because they have a predisposition to have an allergic response to the environment. However, people who do not have any prior history of allergies can also develop a mold allergy. The ways in which patients can develop adverse reactions to mold, either through an irritant or allergic mechanism. Patients can also develop allergic reactions to dust mite because of the increased moisture from a water intrusion. Dust mite has been documented to be one of the primary causes of allergic rhinitis as well as asthma.